Well, it's only a question of time. That's the warning from medical experts who say Canadians can expect to see outbreaks of measles after an explosion of cases in Europe. Get this number. 2 years ago, there were just 1,000 cases in all of Europe. Last year, the number soared to more than 42,000. And measles is not to be taken lightly. It's highly contagious and potentially fatal, especially in children. Joining us for more tonight, like always, is our Canada Tonight medical contributor, Dr. Samir Gupta. Good to see you, doctor. This is certainly alarming. I remember talking about measles when I was in school, which was a long time ago when I was in high school. But how serious is this that it's back? And is it a truly dangerous virus?
Yeah, Travis, I think we need to take this really seriously. And we're partly victims of our own success. The vaccines were so effective for this virus, the MMR vaccine, now it's MMRV. This came out in the early 60s, and 30 million people around the world used to get measles every year. 2 million people, mostly kids, used to die of it. And this was a very feared virus, and people have forgotten because the vaccine was so effective. In fact, in Canada, it was eradicated in 1998. We didn't have local transmission after 1998. That's how effective it was. But yes, people can get sick. For most people, it will feel like a cold. You'll have, symptoms of runny nose, stuffy nose, runny, painful eyes. You'll get some body aches, fever, cough, and then a rash. And you saw pictures of that rash. But for some people, it will be more serious. It will cause inflammation in the brain called encephalitis. It'll cause pneumonia. It can lead to deafness, blindness, long-term neurologic complications. This was a very feared virus once, and we can't forget that.
So in 2021, 79% of children had 2 doses of measles vaccine. That's down from 83% in 2019. Canada's target is 95. So what will this look like if there is an outbreak?
Yeah, and I think it's important for people to realize that the reason the target is 95 is that this is a very contagious virus, like you mentioned. Every person that has measles will spread it to anywhere from 12 to 18 other people. If you think COVID, it was contagious as a virus, and this is the mother of all contagious viruses, and it spreads like wildfire. And that's why you need such a high population immunity, that sort of 95% number, to protect against it from spreading in communities. And so, as you say, we were far below that in 2021. Hopefully, we're better now as people have come out of the pandemic and hopefully caught up with their vaccines. But that number is worrisome. If you look at what's happening in the UK, their 2-dose vaccine coverage is 84.5% by the age of 5. And the number you said, 79% in Canada, was up to the age of 7, mind you, a couple of years ago. So hopefully we're in better shape now, but we're probably still far below that 95% threshold. So yes, we would be susceptible to similar outbreaks to what we're seeing in Europe.
And I know that, there are a lot of concerns with regards to travelers bringing it home. With March break around the corner, should we be cautious in airports about this?
Yeah, this is how it comes. There's no local transmission, at least there hasn't been for a while. And, last year there were 12 cases. They were all travel-related cases. This is respiratory viral season anyways, and you've heard me talk about this before, but if you're in a crowded, poorly ventilated space, there's flu, there's COVID, there's RSV, and now there's one other good reason to protect yourself with a mask. For example, when you're boarding the plane and exiting the plane before the plane's ventilation system is on, if you're in a crowded airport lounge that's poorly ventilated, these are all good places to protect yourself. But I think we can anticipate that measles will come. The world is a small place, and as we see this explosion in Europe, there is so much travel between North America and Europe that this is when we are going to be very susceptible to seeing outbreaks here.
Vaccine hesitancy has been one of the factors linked to low vaccination rates. What is your message to parents who might be hesitant?
Yeah, I think there, as you say, it's one factor. We have to acknowledge that the pandemic made it hard for people to access healthcare, to keep up with their vaccines. I think there's a lot of parents out there who would be happy to get it. They just they haven't gotten to it. They don't remember. They haven't kept up their vaccine schedule because healthcare was so disrupted. Our lives were so disrupted. And then there are folks who are hesitant. And what I'll say is let's not forget how devastating this virus was and how effective this vaccine is. And we have, 60 years plus of experience. We have billions of people who have gotten this vaccine. It's not something new. It's something that's extremely effective. 2 doses with 97% protection. It's extremely safe, and we have a lot of experience with it. So if your child is not up to date with their routine immunizations, including measles, MMRV, and most people would get MMRV vaccine, which covers a few things, including measles, please see your doctor and get your child up to date.
Indeed. Okay, Dr. Gupta, good to see you. That is our Canada Tonight medical contributor joining us from here in Toronto.